Hello, class. The program that I am going to tell you about is the Sound Domestic Violence Program. The question I formed for this program is: in families affected by domestic violence or substance abuse, does participation in Sound's Family Support Program compared to standard community support services lead to reduced rates of domestic violence incidents and substance abuse reports, as well as improved overall family well-being? This question is designed to assess whether the comprehensive, culturally sensitive interventions provided by sound result in a more favorable outcome compared to traditional support or no support services. By examining the effectiveness of these tailored interventions, the evaluation will provide insights into how well the program meets the needs of families, thus lessening the need for government services and building stronger families with less trauma that needs to be government informed or the government brought in. Domestic violence and substance abuse are critical social issues with severe implications for the individual, family, and society. Statistics are grim, as we all know. 25.3 of individuals have been the perpetrators, with women being more likely to be the perpetrators of domestic violence. Approximately 1 in 6 children have witnessed DV. According to the report by U.S. Department of Health and Human Services, children exposed to domestic violence are more likely to be involved with child protective services. What are your thoughts with domestic violence? Think on the problems that domestic violence brings to each children and to our culture and our country. Domestic violence is a huge problem. Domestic violence creates challenging environment for affected families and our communities, underscoring the need for targeted and effective intervention. Domestic violence is often driven by power imbalances and controlling behaviors within relationships, while substance abuse is influenced by a mix of biological, psychological, and social factors, frequently interwoven with trauma and familiar stressors. This program focuses on families affected by domestic violence and substance abuse, targeting both immediate and long-term needs to improve their overall well-being. Participants include families where domestic violence or substance abuse is a significant issue. These families often experience complex challenges such as safety concerns, emotional trauma, and family disruption. The program will operate by emphasizing client empowerment and resilience building to enhance overall family well-being. Over a 90-day period, the program will utilize a team of 23 rotating staff therapists who will engage with each family on a weekly basis. This structured intensive support is designed to improve communication, reduce incidents of domestic violence, and foster long-term stability without burdening the government. Sessions will be held at designated community centers, ensuring accessibility for all participating families. Sound's program goals are counseling sessions, which are designed to help families process trauma, build resilience, and develop healthier coping strategies. Support groups are another critical component of the change theory for this program. Educational workshops are also another component. By equipping participants with knowledgeable and skills in areas such as parenting, healthy relationships, and substance abuse prevention. And the last one is the shelter emergency placement, which provides immediate safety for families in crisis, ensuring they have a secure environment while engaging with other program services. Now, my theory of change for this program posits that integrating these components, counseling, support groups, educational workshops, and emergency shelters, families will develop improved coping mechanism, enhanced communication, and greater overall stability. Now, you may ask, why is this program needed? One, for complex interplay of issues. Two, trauma-informed care. Three, empowerment and resilience. Four, cultural sensitivity and inclusivity. And five, comprehensive support services. Now, my problem theory evaluation that I've used on this program involves assessing how well the program addresses the core issues of domestic violence and substance abuse within participating families. The program's problem theory posits that these issues lead to significant emotional and behavioral dysregulations. And these are the methodologies that are used. Assessment of trauma and emotional dysregulation, which we are using the Trauma Symptom Inventory, TSI, the General Health Questionnaire, GHQ, and those measure the changes in trauma symptoms. We're also using the Family Dynamic Stability, which surveys and interviews with participants to assess changes in the family dynamics, communication patterns, and overall stability. This family tool is called the Family Assessment Device, FAD, and it is good for trauma. So theories supported by the ecological system are also being used. The ecological system theory posits that individuals are influenced by multiple layers of their environment, including family dynamics and society. This theory helps explain why addressing domestic violence requires more than just immediate support. It involves addressing a broader social and family context. Similarly, the social model highlights that substance abuse is influenced by biological and social factors. So they both need intervention approaches that are unique to trauma. The evaluation of Sound's family support program integrates qualitative and quantitative data to assess both the problem and the change theories. By examining improvements in trauma symptoms, family dynamics, and access to services, the evaluation determines the program's effectiveness. And this is needed so we can measure how well the program is doing. A key evaluation study on comprehensive family support programs was conducted by Davis, who reviewed the multiple interventions targeting domestic violence and substance abuse in families. Their findings highlighted the importance of counseling, support groups, and educational workshops, similar to Sound. All of this literature review found that randomized controlled trials and quasi-experimental studies were commonly used to evaluate the program's effectiveness. Thus, we're kind of copying what our literature did, and we're also adding some more methodologies. Also, I believe that further studies are needed to evaluate how programs like Sound's program and how they advocate for marginalized community. So this is something that as social workers, we're all aware of. Additionally, longitudinal studies tracking families over extended period would offer valuable data on sustained outcomes and the long-term benefits of integrated support. Now, a critical social justice implication of the existing literature I read is the insufficient representation and consideration of diverse culture and socioeconomical backgrounds among participants and researchers. Many studies lack the comprehensive demographic data about the populations, including racial, ethnic, and socioeconomical information. So, Sound's family support program is evidence-based practice with an understanding of the unique needs of families that are affected by domestic violence and substance abuse. Though there are many areas for doing better, the program's approach incorporates the counseling, support groups, workshops, and shelter. However, more is needed, and it's hard with the lack of money. In conclusion, the Sound Family Support Program offers a promising and comprehensive approach to addressing all of these issues of domestic violence